LDL matters. For years, we have been taught that LDL, the so-called bad cholesterol, should be as low as possible. Even doctors celebrate when your LDL is less than 70. That means fewer heart attacks and fewer strokes. But here's the twist, my friends. In massive population studies, people with LDL that low sometimes actually die more often. Apparently not from a heart attack, but from other things like infection, cancer, or just frailty. And the people who live the longest, actually they have their LDL closer to 120 or 140. So which one is it? Tonight, I'm going to walk you through that paradox. Yes, it's a paradox. We'll look at the big trials, the real world data, including one of the biggest studies ever out of Denmark. And by the end, you will know what this means for you. Stick around. Before we dive into the studies, let's get one thing straight. LDL is not a poison. My friends, LDL is not a poison. It's not this evil thing floating in your blood. LDL is simply a lipoprotein particle. Its only job is to carry cholesterol around your body. And the cholesterol is very essential. It builds your cell membrane, every single one of them. It's a raw material for a lot of hormones like estrogen, testosterone, and cortisol. Cholesterol is very important for a very essential vitamin, vitamin D production, which is important for your bones. And it makes bile acids. These bile acids are very important for you in order to digest fats. But here's the analogy that I use with my patients. LDL is like a delivery truck carrying building supplies. If you have too much trucks, the highways clog up and there are plenty of accidents. That's the plaque in your arteries. But if there are no trucks at all, deliveries stop. The city shuts down. The truth is, my friends, your body needs LDL, but the trick is it needs it at the right amount. Now, let's talk about why our favorite physicians, the cardiologists, celebrate LDL below 70. The evidence is ironclad. Number one is Prove It TIMI 22. Over 4,000 patients after a heart attack, those who got their LDL below 70 had 17% fewer events. Number two, Improve It. Almost 20,000 patients. Adding Lydia to their regimen pushed their LDL down to 53. That cut their major events by 6%. Number three is 4-year. 27,000 patients with vascular disease. If you look at a map, dropped their LDL into the 30s. Their heart attack fell 27% and their stroke fell by 21%. Odyssey outcomes, nearly 19,000 patients after acute coronary syndrome. Eculizumab lowered their LDL into the 50s. Cardiac death and heart attacks dropped significantly. Here's the takeaway from this. For every 40 points, 40, you lower your LDL, you cut your cardiac events by 20 to 25%. For arteries, lower really is better. And no trial has shown harm at a very low LDL, at least from a heart standpoint. But here's where it gets interesting. When we zoom out and ask what LDL level is linked to the living the longest overall, the answer looks very different. Number one is National Health and Nutrition Examination Survey in the United States. They found that mortality followed a U-shaped. That means too high was bad and also too low is bad. El Brocchi study in Japan, 90,000 people followed for 14 years. Lowest death rates when LDL was between 120 to 140. Below 80, cancer, infection, death went up. Number 3 is Korean NHIS study. Over 500,000 people, same U-shaped curve. Too high or too low LDL shortened survival. And then lastly, there is the BMJ Denmark study. It's called the Copenhagen General Population Study. This one shocked the field. Over 108,000 adults between 20 to 100 followed for nearly a decade, 10 years. More than 11,000 deaths were recorded. Here is the summary from this study. People with LDL below 70 had 25% higher risk of death compared with those in the middle range. Number 2, people with very high LDL above 190 also had higher risk. The lowest overall mortality was called the real sweet spot, was at LDL around 140. But there is nuance for people on cholesterol-lowering therapy. The lowest risk was at LDL around 89. So what does that mean? What can I get from that? What I get from that is if your LDL is low because of medication, that's protective. But if your LDL is naturally low, say you are older or frail, it might actually be a sign of illness, not health. That's the paradox in action. So the question is, why might LDL under 70 raise risks outside of the heart? Well, immune defenses. LDL binds bacterial toxins. Too little may weaken your protection against infection. Number 2, cancer biology. Cholesterol helps cell membranes and immune surveillance, and without those, defenses may falter. Number 3 is frailty. In the elderly, low LDL often reflects poor nutrition or chronic illnesses. And number 4 is hormone balance. Cholesterol is a raw material for, yes, estrogen, testosterone, and cortisol. Ultra-low LDL might stress these systems. Number 5 is brain health. Cholesterol supports synapses. Very low levels have been linked to depression and hemorrhagic stroke. So LDL is not just a risk factor. It is a fundamental piece of biology. So when researchers plot survival curves, the best overall survival often sits between 100 and 140. That doesn't mean LDL 140 is good for your arteries. Plaque still forms, but it might mean that at that level, at this whole body level, this is where the systems balance out. Arteries protected enough, but hormones, brain, and immunity not deprived. Think of it like a blood pressure. If you have too high of a blood pressure, you are at a risk of stroke. If you have too low a blood pressure, you are at the risk of passing out or syncope. The body thrives in balance. LDL may work the same way. So here's the question: why do trials and real-world data look different? Trials, they enroll only high-risk cardiac patients. They exclude the frail elderly patients, they exclude other patients, and measure only heart events. They show lower is always better for the heart, while population cohorts include everyone. Low LDL often means hidden disease. They show higher mortality at the extremes, the very high and very low. Both are right. They are just answering different questions. This is where personalization comes in. If you have had a heart attack, stent, diabetes, or peripheral artery disease, aim for LDL less than 70. That's where the benefits are proven. But if you are a healthy 45-year-old male or female with no plaque, LDL between 100 to 130 is probably fine if your lifestyle is excellent. If you are 80 and frail, forcing LDL down to 60 might not help. Actually, it could even hurt. Long story short, there is no single number for everyone. Here is how I apply this with real patients. A 56-year-old man with 2 stents, his LDL is 48 on PCSK9. That's perfect. That's protecting his heart. While 65-year-old woman with 0 calcium score, no plaques, her LDL is 125. I won't panic. An 83-year-old frail man, LDL is 72 with no statins. That doesn't reassure me. That low LDL might be a marker of illness, not protection. We don't treat numbers, my friends. We treat people. Here is the cholesterol cheat sheet. LDL less than 70 is best for people with heart disease. What about between 70 to 100? Still protective for most. What about between 100 to 140? Linked to best survival in population studies, especially in elderly patients. If LDL is above 160, clearly harmful. Plaque grows faster, risk of stroke and heart attacks jumps. If your LDL is less than 50, that's safe for short term in trials. But there's a lot of long-term risks like immunity and cancer. So be aware. So the paradox is not contradiction. It is a context. For arteries, lower is better. For survival, balance matters. So here's the bottom line. LDL of 70 reduces heart death. But in the population studies, it sometimes increases death from other causes like infection, cancer, and frailty. The sweet spot for longevity in the general population often lies around 120 to 140. The lesson here, LDL has 2 faces. Too much clogs arteries. Too little may weaken the rest of the body. That's why LDL goals must be personal. For the heart, lower is better. For life, balance is best. And that's the art of medicine. Thank you and have a great day. Bye-bye.